Hi, welcome to Elegant Implants. My name is Dr. Catherine Ye, but all my patients call me Kat. We're excited to have you here. Unlike a typical dental practice, you'd come to Elegant to meet with me, the dental director, and we'd have a conversation. We would discuss you, your medical health, your concerns in the mouth, what your interests are, what your goals are, what you think you need, any pain you're having, the aesthetics you're aiming for, just so I get a better sense of who you are as a person as well as a patient, so we can better treatment plan for you. Once we have what we call that consultation and we actually get to know each other, we come back to the operatory, have you sit in the chair, and we'll do just an exam, comprehensive exam. Feel around the head and neck, take x-rays, look in the mouth, make sure your gum health is good. And once we have complete information on you as a person as well as a patient, I will treatment plan for you. That means putting together all of the things that we think you need, combined with the things that you are interested in achieving. We'll talk about that to make sure that you as the patient are aware of every single procedure that we have planned, as well as all of the costs up front. I know a lot of times patients are upset or surprised by the bill at the end of the procedure. We want to make sure there's total transparency and the patient's fully aware before signing anything, before embarking on any procedure. And once we come to an agreement, we can move forward from there. At least to my knowledge, most dental general practices don't have a consultation or an interview at all. Usually what happens is you show up at the dental practice for the first time and you're handed a notepad and asked to fill out a medical form. And that's absolutely fine if you provide all the information. But usually the your interaction with your dentist is pretty minimal, and there certainly isn't much time to actually sit and have a real conversation. So the fact that we do the consultation at all already is unique. That combined with the fact that we don't schedule patients back to back to back to back, so we don't really have a tight schedule to keep, so we have the flexibility, we have the freedom to spend that extra time and energy getting to know our patients and making sure that we understand fully what their concerns are. Yeah, so the fact that we're not the typical dental practice, we're basically a group of specialists, means that we're not quantity-based at all. We're not trying to get volume of patients in and out the door. We're really just focused on providing the highest quality of care we can to the patients that we are seeing. So generally speaking, the workflow in the office is very, very relaxed. It's nice. Most patients, when they first come into the office, mention how they appreciate that it's not totally sterile. It doesn't seem like everyone's bustling around trying to, get to the next appointment, get to the next patient, move from operatory to operatory. It's just, come in, have some coffee, sit on a couch, chat with whoever's around. And then when you come in to sit in the chair as the patient, you will never feel rushed because we're not rushing you. We're really trying to get to know you, trying to be familiar with your teeth, with your concerns, and providing the best care possible. Usually the length of the consultation interview and the comprehensive exam oftentimes is patient directed. So if patient's in a hurry, has somewhere to be, will work at their pace. But most patients do appreciate the fact that their dentist is trying to get to know them. So most patients come here understanding that we have flexibility, we have freedom, and most people want to take advantage of that and just sit and chat and not feel rushed, not feel pressured. So I would say on average, the interview can last anywhere from 15 to 45 minutes. The comprehensive exam can last anywhere from 45 minutes to 2 hours, really. Okay. So usually at a normal general dentist practice, if there's a procedure that's too complicated or too time-consuming for the general dentist to perform in office, he or she will refer that case out to the specialist, the root canal specialist, the oral surgeon, the gum specialist, the denture specialist. So it's on the patient to go to that other practice, meet with that specialist, and hopefully set up an appointment for the procedure. usually paying a lot more out of pocket. Here at Elegant, because we're a team of specialists, once there's a procedure that is appropriate for one of our specialists, we just call up the specialist and we help facilitate the appointment for the patient to get the procedure done that they need. And because the specialists are part of Elegant Implants, there's no extra referral costs, there's no special out-of-pocket costs. Basically, everything you pay for here are Delta dental fees, the insurance fees, whether or not you have the insurance. So even though you're getting treated by a specialist, you're still paying regular insurance prices, which is unique. So when you're referred to a specialist from a regular general dental practice, you go to the specialist and you're paying, higher fees, out-of-pocket fees. Usually those services provided by the specialist aren't covered by insurance. But here at Elegant, we're all about providing more care, better care to more patients. So we want to make sure that the patients who come to us are able to afford the services we can provide. So even though those patients are seeing the same type of specialists who've trained for, on top of their college, their dental degrees, they've spent anywhere from 3 to 8 years additionally training to be specialists in that field, whether it's prosthodontics for dentures, oral surgery, endodontics for root canal procedures, periodontics for gum health procedures. Even though you're seeing these same specialists, you are still paying kind of general dentist prices, which can be, up to 70% less than what you would pay at a specialty office.